It's working. Yay. So the question that I posed, and we started to talk about for it, was do you have any medical problems that you could consider genetic? And I know Dad mentioned gallbladders.
Gallbladder. I was the last one to have my gallbladder out, and I was
Well,
68, 69 years old before I had mine out.
So that's recent.
it was after,
Oh, yeah.
several years after he died.
That was one of the times I scared your mom.
Yes.
Okay.
Well-
You're fine.
Well, I had heartburn.
Mhm.
Not a big deal. It
I was
happens
sleeping
happens from
2 o'clock in
time
the morning.
happens from time to time over most of my lifetime.
Mhm.
So I got up, took some Pepto-Bismol.
Didn't have.
Didn't help. So I got up and took some of her antacid pills. That didn't help either. And finally, like 2:30 in the morning, I hadn't had any sleep, and it was killing me. It was painful. So I woke her up and said, "You got to drive me to the hospital."
Knowing your dad, you know, when he says I got to go to the hospital, you better get out of bed and get it done because he just
Well, I hurt
doesn't
so
do
bad I
that.
didn't feel like driving. I made her drive.
And then we went out to get in the car and it wouldn't start.
Yeah, it wouldn't start. The battery had gone south on us. We got in that beat up old Mercury that the gas gauge didn't work on. We got in that, and I had just filled it up the day before, and she was fretting because she thought she was going to run out of gas before we got down to the hospital. But even after we got to the hospital, the folks there were a little concerned too, because of the pain that I was having. Led them to believe that it could have been an aortic aneurysm.
That's scary, scary stuff.
Absolutely. So they very quickly ran me through
Cats.
CAT scan. Yeah. Decided it wasn't an aneurysm, and then they were gonna do an ultrasound.
They never did.
Come back in a couple of days to do the ultrasound. Well, 2 nights later, I was back down in the emergency room. It was about killing me. Well, the next day, that was Wednesday, and the next day was scheduled the ultrasound.
That's when we discovered.
Went in and did the ultrasound. Well, that wasn't really conclusive either.
No.
But they were pretty certain that the problem was gallbladder. We got in and did the gallbladder, and I didn't really have a set of gallstones as you normally have for gallbladder problems. It just was clogged up.
So they took it out.
They took it out.
So,
Haven't since then. Haven't had any problems.
But Stacy had some of hers, and hers was congenital. It was in there when she was born
okay.
because it was a deformation of her gallbladder.
Yeah.
And she was sick all the time. All it took was get her upset, and she was sick.
Well, the worst was when
And then
when
your
Dad
mother-
died.
yeah,
Well,
when
she
your
was
dad died.
11,
Yeah,
and she got really sick that time.
she was in
And
the hospital.
she was in the hospital. But after that, there was numerous times that she had problems, and the doctor was kind of like, well, this is sort of like gallbladder problem, but you're too young to have gallbladder problems. So
They poo-pooed that, and she would just.
when they finally
She was
took her
so ill.
gallbladder out,
They found out that it was deformed, and it was not allowing the fluid to go out of it, and so she's. Yeah.
but she was in her 30s.
Yeah, it was in her 30s. It was
And for nearly
nearly all her life.
nearly 20 years, they've been saying, well, this is kind of like gallbladder, but you're too young.
But Mom, you've had your gallbladder out too, haven't
Yes. I had mine out before he had his out.
Oh, yeah.
I had mine out when we were in Great Falls.
you? But your mother didn't, that you knew of? I know we can't ask about your biological father because nobody knows, but
Well, somebody knows, but I don't. No, Mother didn't have gallbladder problems. She had rheumatic heart problems. That's what she died of. Was congestive heart failure, caused by you having rheumatic fever when she was a child.
Oh, is that where you got your rheumatics from?
That's why they took me out of school, because I was having strep throat. Almost, I'd get rid of one and then come right back. And so they put me on a regime where I took penicillin every day.
What fun.
Huh?
I said, what fun that must be.
Yeah, but what was really fun is they took me out of phys ed. So I didn't have to go to phys ed all the time I was in high school,
This is because you had rheumatic fever?
because the strep throat can lead to rheumatic fever.
Okay.
And they just said, just not worry about it, you know. You can survive without taking phys ed.
Yeah. She had strep throats, but she also had some of the joint pain,
Yeah.
discomfort that goes with rheumatic fever.
So,
Maybe it all quit when she got married.
I didn't know. I still had strep. Not like I did, because I...
See, after she got married, she didn't have to get out of phys ed.
I graduated from high school. Finally.
Not until after you were married.
Not till I got married, that's true. Yeah.
That's a story for another day. We should talk about it.
Yeah, another story, another topic.
And then when we were in Great Falls, and I started having really bad stomach aches. And finally, I went to Dr. Susan, and she said, this is gallbladder. Just schedule it and take it out. I said, okay. Little did I know. See, when he had his gallbladder incision like that, right here on his belly button. Me, I had a incision from here to here.
I really didn't have any incision. I had 3 little holes.
Yeah, I remember yours, because you had a stapled shut. Stapled.
There's just the whole thing clear across. That's when I learned to hate his the breathing people, the respiratory therapist.
Oh, yeah.
Because, you know, when they cut your belly open and then they say, laugh, cough, no, I'm going to do it. It's just too bad. But, you know, when you have an incision that big, that's not something you get over with.
So, back on the medical things, Mom had a stroke and back surgery.
Same year.
Same here.
Same year. Because I remember that was a bad year.
Then we moved.
So I know this is, now I'm talking hard subjects, but was any of that congenital? Do we have any?
No, it was caused by a small bleed, which was caused by hypertension.
Okay.
Yeah. And I wasn't taking any medication for my hypertension to keep it under control, because I didn't have a doctor, because we moved to Glenwood. And the first time I went to the doctor was when I was in the midst of the stroke, because I didn't have one. I didn't know who to go to. And so I just went over there and went to the doctor, and he said, we're going to give you something to bring the blood pressure down. Took me in a back room, turned out all the lights, put some medicine underneath my tongue, and laid there, and it didn't go down. So, as they said, well, we're going to have to put you in the hospital. Okay. So I would just go get in the car and go, no, we're not going to
The
call the
hospital was
hospital.
across the street.
It's across the street. And they called an ambulance to put me in that ambulance and carry me around the hospital to put me in ICU. You know, it was, what, maybe 100 yards? A little farther than that, but it was right across the street. And
More than 100 feet, it wasn't 100 yards.
so it was funny, and it was kind of discouraging. But your dad was terrified.
I could imagine.
And when we called somebody to come and give me a blessing, he couldn't help.
You had to call two people, not one. I can't imagine.
But yeah, you've been there a little more than we have. But no, he was really scared. But as to genetics, I don't think so. You know, the hypertension is just, it was because I wasn't taking care of myself. Wasn't doing anything.
Well, but along with that, the reason why I asked that is because now we know that Dad had a cardiac arrest, not a heart attack. Close enough, but it wasn't exactly a heart attack.
No. His heart was not
Clogged
damaged.
arteries. My dad died of heart failure, cardiac arrest, when he was 70 years old. Since he avoided doctors religiously, we don't know what led up to it, but
I do. He just quit living.
he quit living.
He was
My-
not the same
my-
person
my
as
mom
her-
was
as
diabetic.
his mother died.
And that's what led to her death. Complications of diabetes. It was heart failure, but complications
She
of
had
diabetes.
strokes too.
And but I know there's diabetes in my siblings. I think Ted is diabetic, and so is Bonnie. I don't know. I don't know if anybody else is.
Well, talk to my brother, get his list of ailments, and my list of ailments. You can almost swap them.
Oh, they're like completely different? Or
No,
or almost
they're
identical?
almost identical.
Identical.
Okay, so that implies
Yeah.
genetics. We can't say it is, but that implies genetics then.
Well, I assume that it is because, you know, he had, I don't know that he has diabetes.
David?
Yeah.
He does.
Okay. But he hadn't had stroke. He had a heart attack
Mhm.
several times.
Wow.
And when they discovered he was having a heart attack, he was in there to have surgery for something else, and they put him through the stuff, the pre-op stuff, and discovered he was right in the middle of a heart attack. He had pain sent up his neck, and but we have just about the same ailments, but he's a lot hairier than I was. He still is, because I lost enough weight to.
What about knees and ankles, Dad? Because I know that well, Mom broke her ankle, but that's not genetic. That was falling out of the trailer.
Yes.
Well,
And Stacey had knee surgery.
yeah. That's different from mine.
I don't know.
What Dr. Orchard told me, and Dr. Watts hasn't said it specifically, but I think, is that I have symptoms of arthritis.
Mm-hmm.
And is that hereditary? My dad had arthritis fairly bad in his back and his hips especially.
Yeah.
Well, the doctor,
Mine
the podiatrist just told me that I probably have arthritis in my left foot. Ironically, not the one he's treating, but...
That could be. And Dad's back problem, you know, arthritis has a tendency to go into joints that have been damaged.
Mhm.
When my dad was a young man, he was in a accident in the mines that didn't break his back, but it damaged it. Well, it was enough that he was in a cast. He was in a body cast for a while, you know, hip to armpits.
Whew.
And I don't know how long, but for a while. And so my knees and ankles, are they arthritic because of heredity? I don't know. Dr. Watts is convinced that I'm fighting off that arthritis to some degree because of my activity level. Keep running, keep moving. That helps forestall arthritis. Because everybody tells you one of the best ways to deal with arthritis is to keep moving, but it gets painful to where you can't or don't want to. So it's
Yes.
and I take the glucosamine, and I hesitated that for quite a while because it's kind of expensive, but it definitely made a big difference in the mobility of my knees. Huge
Well-
difference.
Well, the reason that I suggest that is because I know that, Stacy had knee surgery. James has back problems, but I think he earned his.
Well, part of it's because it's too heavy.
But Mike mentions that his knees and ankles are going out on him. And every once in a while, when I get down too far and I stand up straight, my knees ache. Like that strain on them, and they just hurt. So that's why I asked. Is that
Maybe.
genetic?
My back has bothered me since I was a teenager, off and on.
Mine.
Is that because I misused it, didn't take care of it? Is it because of heredity, or both? Or neither one?
Maybe we're just hereditarily disposed to not taking care of our back.
Well, truthfully, physically, our backs aren't designed for us to be upright. So back problems is rather common in the human race.
Yeah, I've had surgery 3 times on my back.
Yeah.
James has had it twice.
I think he's only had it once.
I think didn't he come home from his mission
Early. Yeah.
early with back problems, and they did surgery then.
Yeah.
And then I know that he worked and hurt his back, and they did back surgery again. I think they did surgery. Did something on it.
Yeah.
I don't think he had the second surgery. But when he had surgery the first time, when he came home from his mission, they didn't really cut him open. They just kind of made a hole about the size of a pencil and went in and removed the fluid from the ruptured disc. They went in on the side,
Yeah.
past the kidney. I don't know. Kind of, it's hard to say. I'm not diabetic. Not even close to it. My mom was severely diabetic. She was taking insulin for a number of years before she died. Dad died of heart failure, had emphysema, seriously bad emphysema.
But
he's-
that's not hereditary.
But he smoked for, 65 years. Well, 55 years, I guess. 55 years. So, what impact did that have on
Yeah.
those things? A lot. The evidence is overwhelming that smoking is hard on your heart.
Mhm.
And I don't think, if Dad ever had a heart attack before he died, he didn't let on.
Well, there are some tough SOBs that will do that.
Yes.
And he was one.
Well, he was a cantankerous old curmudgeon.
He got really curmudgeon after your mother died.
But the only time that I ever remember him being in a hospital at all is when he had the hernia. And we almost had to hog tie him to get him in there for that.
Yeah, he all made sure that and then they stayed with him. Yeah, so they didn't get up and move and go home
Yeah, it was.
because they would have.
Cantankerous old coot.
Yeah, he was. He got worse after your grandmother died.
Okay.
I think that's the best we can come up with.